After COVID, we saw an influx of dogs with separation-related problems, and that just hasn't stopped. These cases can be really stressful because there's a lot of detailed history and they never really present in one exact way. Matter of fact, separation-related problems, or SRPs as we call them, you might also see them as separation-related disorders. They occur on a spectrum. One size does not fit all, but with my 5 tips, you will improve your success rate treating these cases. Number one, ask the right questions. The most important questions at that initial appointment are the frequency of the behavior. Does it occur every single time the pet parent leaves the house? Only with one pet parent? Only when the dog is completely alone? Only when the dog is confined in a crate? Only when the dog is loose? Get that information. Number two, the intensity of the behavior. What's actually happening? Is the dog depressed, destroying the door, trying to escape from the crate? Are they presenting to you with a fractured canine because they've already injured themselves trying to escape from the crate? And find out about the home environment. What exactly is your treatment supposed to do? Is the family gone for 8 hours, 1 hour, 2 hours? Just knowing those things will help you choose the right medication. Another thing that we want to know is the character of the behavior. When does it start? Sometimes these dogs get upset as soon as the alarm goes off in the morning. Sometimes it's not until the door closes. Having that information will help you know how to dose your medication. Number two, work up your patient. Yeah, really work them up. CBC, chemistry, free T4, urinalysis, a fecal DX with Giardia antigen. Pay attention. Does this dog have a history of loose bowel movements? We might have an IBD patient or a food allergic patient. What about pruritus, allergies? Does he sit on his side, maybe kick his leg out? We might have a torn cruciate. All of this stuff adds up. If you're wondering how it all adds up, I have a video on my YouTube channel talking about how behavior problems go from bad to worse very fast. Number three, treat separation-related problems as emergencies because they are. These dogs are hurting themselves and people are prisoners in their own home. You have to act quickly. So you're going to prescribe a short-term medicine right now, today, and you'll prescribe a long-term medicine that the patient will start after the workup, so usually 3 to 5 days after that first appointment. It's going to take time for them to understand how to give that short-term medicine. In other words, they're going to have to try different doses at different times before departure. So they need that 3 to 5 days or 3 to 7 days anyway to get that worked out. Those long-term medications are antidepressants, Reconcile, Clomicalm. Those will take 4 to 6 weeks to work anyway. So we want to get that short-term med on board ASAP. Number four, don't wait to medicate. When you consider your medication choices, think about how long the family is gone. If they're gone for 8 hours, you might need a longer acting medicine like trazodone. If they're gone for 4 hours, you might need a shorter acting medicine like alprazolam. If they're gone somewhere in the middle, 6 hours, you might need gabapentin. Do you want the pet to eat while the parent is gone and right now they display an appetence? You might need a benzodiazepine for that. What about the pet who is bouncing off the walls and destructive? You might want them to be calm, so you'll choose trazodone. So don't get wrapped up in getting that perfect diagnosis because it's more about medicating for those clinical signs, okay? Number five, change the environment. This is a no-cost option for pet parents that can make a big change. The dog could board at your clinic for the day, go to daycare, stay with a relative, stay with a pet sitter. Maybe the pet parent can take their dog to work. A lot of offices offer that now. Maybe the pet parent can leave the dog with food toys. This is a highly effective way to distract a dog, and there's studies showing that dogs stay calm while they're eating and also after they are eating compared to dogs who don't have food toys. If the pet won't eat when the pet parent is gone, use a benzodiazepine or gabapentin or pregabalin that will increase the appetite so the dog will eat. A lot of dogs are panicking in the crate. Can we just get the dog out of the crate and maybe the dog might be fine, or at least maybe 50% better while the pet parent is gone. Changing the environment is a huge part of helping these dogs get better. A great way to help a dog calm down fast is to use a pheromone analog like ZeniDog from Vervac or Secure from Signs. Pheromone analogs can work pretty fast and they've been proven to help dogs feel calm. Don't forget to ask the pet parent to hide some of those departure cues so the dog isn't quite as triggered, and use those first line defense products like Purina Calming Care, for example. Where's behavior modification in all of this? Look, nobody loves training a dog more than me. But these first line 5 ways to treat separation related problems will get you off on the right foot so you can get your thoughts together and recommend the right positive reinforcement training program for that dog. Good luck. You can do it.